You did it! You helped keep the doors open at Planned Parenthoods and hundreds of other reproductive health care centers around the state. Starting in January with our Day of Action, advocates like you came to the Capitol. You called and emailed lawmakers, and you visited them in their district offices. You delivered a simple message: make family planning funding a priority in the state budget to keep our doors open. And your activism worked. The budget is now passed, and we are very successful in protecting funding for our core healthcare services. Plus, your actions helped us maintain funding for important programs like rape crisis and pregnancy prevention services. Your voice in support of family planning advocates was loud and clear. New York's decision makers know who we are and what we stand for.
Family planning advocates have been those whose advocacy has made New York a better place to be, with practical service and passionate advocacy.
Family planning advocates is viewed as one of the most credible entities and advocacy organizations that we have in our great state.
Your strong support of healthcare reform helped pass the most sweeping overhaul of the nation's healthcare system in decades. Some lawmakers in Washington were on the fence about healthcare reform. But again, your calls and emails and your trip to Washington helped get those votes we needed. Now, tens of millions of women and families will have greater access to reproductive health care. Gender discrimination and pre-existing condition exclusions in health insurance are a thing of the past. As the legislative session wound down, you also helped get the Reproductive Health Act introduced into the state assembly for the first time. New York needs RHA to protect women and women's health care providers. Members of the Assembly read your emails and heard your calls. They took action towards updating New York's abortion laws through RHA. When the state legislative session ended this week, RHA was an active bill in the Assembly and in the Senate. This is the closest that we've ever come to making RHA a reality in New York. But we are extremely disappointed that it did not become law this year. Legislation like RHA that protects women's health should sail through a legislature in a pro-choice state like ours. Our legislature needs to be a better representation of the overwhelming pro-choice majority in New York State. We need more pro-choice lawmakers like these in New York.
Protecting women's reproductive health and rights is imperative. We will get it done. I thank you for making me a champion. We will all be champions.
The Assembly is a pro-choice, pro-women house. The governor is pro-choice, pro-woman. The AG is pro-choice, pro-woman. The controller is pro-choice, pro-women. And the New York State Senate is a pro-choice, majority-led conference.
We also need leaders who are committed to reproductive justice and health care in New York State. In announcing his candidacy for governor this spring, Andrew Cuomo proclaimed,
"My friends, we will steadfastly protect a woman's right to choose,"
and he will fight for the passage of the Reproductive Health Act. When the 2011 New York State Legislature convenes, these are the kinds of pro-choice elected officials who will take action on women's healthcare issues when you call, email, or visit. Sustained family planning funding, healthcare reform, and the advancement of the Reproductive Health Act. We achieved these successes together with our strong voices and a unified message. Your thousands of calls, emails, and visits made the difference. Our fight is not over. We will need your activism moving into the fall to ensure New York's lawmakers reflect our pro-choice majority. We look forward to continuing to work with you because, together, we will make this happen.